have Marcus Hitler live? It seems one of those days, folks, with regards to connection with our reporters. But speaking about, to the families of doctors and other healthcare workers who have died from COVID-19. As we've been saying, the pain of this pandemic is all too real. We're dealing with so many unknowns here. How do you put it all into context in order to move forward? Markie Ketler is, I understand, back on the line with us. Markie Ketler, tell us the latest with regards to how families coping with regards to COVID-19.
Yeah, Blaine, what can we say? I mean, they take care of patients, and during this COVID-19 pandemic, they take care of patients infected by the virus, but they eventually become patients themselves. And of course, here you're talking about the health workers who are in the front line of this particular battle we are all facing, Blaine. But here is the issue. I mean, the anxiety, the stress as well, and the fear they're actually subjected to, more especially with these new developments of the allegations of corruption surrounding the procurement of the PPEs or personal protective equipment. We did speak to some of them, Blaine, at Telemkhweran Hospital in Vosloorus, just on the east end. And of course, you can actually read the anxiety in their face when they speak to us. In fact, when we waited for them at the gate, many of them had doubled up. They had 2 masks in their face, and when you ask them, why are you actually wearing 2 masks, 2 face masks, and they're saying that this is simply because they do not feel safe. They are fearful for their lives. Some of them that we spoke to, they are saying that they had already recovered from the COVID-19, and of course they had to be in isolation at home. The issue here is that those around them, their families, are also infected as soon as they arrive at home. And also what we are getting is that they are aware of these developments. They do follow news. They do follow these developments. And what they are saying is that it really does bother them to actually hear this news of alleged corruption and yet witnessing their colleagues losing their lives almost on a daily basis. But of course, we actually managed to speak to one of the nurses at Telemkhweran Hospital just yesterday, Blaine, and let's just listen in to what she had to say.
It's so scary, so painful. You can't resist. You are getting irritable. You don't know what to do. It's very sad and painful. And then you must come back here. When you are coming back, there's a lack of PPE. You don't get full PPE. So it's so painful. We are working under the stress. We are working under a lot of pain and suffering. You are losing your colleagues. You are losing your friends. So it's painful. You can't be a normal person. You can't be. We are not normal, all of us. We are just working because we make an oath that we are going to serve the community. But we are so scared for our lives.
And of course, fearful for their lives, simply because almost every day they actually have to drag their colleagues out of those wards in body bags. And that is the anxiety that they are going through on a daily basis. But of course, unions have actually voiced their concerns really around these issues, saying that really this could have been avoided if there wasn't any issue regarding the procurement of the PPEs that many of the nurses are actually subjected to. Let's just have a listen to what one of the unions had to say.
As an association, it's very concerning for us to note that so many of our members, so many of our colleagues, and so many of our frontliners have, 1, been infected, and 2, almost 200 have succumbed to this virus, especially when we know that so much could have been prevented had there been less corruption and less manipulation of the funds that we used for the procurement of PPEs for the public sector.
And of course, with that said, Blaine, one of the questions that actually rang out among those nurses that we spoke to, some of course could not speak on camera. The main question that we had throughout that interview is, who is next? Who is next? Could it be the cleaner? Could it be the doctor? Could it be one of us here as nurses? And that's a question that's haunting them at this stage. Blaine.
Look, nurses and doctors are indeed on the front line fighting this virus, this disease, but I guess COVID-19 is a battle that needs to be fought by individuals and families as well. That's how we need to contain the spread in this fight against COVID-19. Mark Aketa, live for us there. Thank you very much indeed for your reporting.